Good morning, Tatyana.
Good morning, Dr. Sarkis.
How are you today?
Very happy.
You are very beautiful.
Thank you.
I'm gonna play the video we took for you some time ago. I'm gonna just switch this lights off. If that's okay. Let's hear what the video says. This is your first consultation. Okay, Tatyana, good afternoon, my dear. Good afternoon. Thank you for taking the time to listen to you.
My pleasure.
It's your first visit today, and I think that you are very beautiful woman, and I mean that. Now, usually I ask by asking questions, but in terms of what is the main concern that you're presenting today? Tell me your story and what you would like me to do for you.
Okay, thank you.
Mm-hmm.
Probably a few things that disturb me in particular. The unevenness in the shape, especially on the side. The teeth are a little warped, so they give off that perspective. They don't allow for a nice, smooth, even.
We'll show you that on the screen there.
Especially like on the side there, they just seem to ruin the whole, visually the whole
The dynamics,
the dynamics is off, so it just puts everything else off.
Yeah.
Ideally, I would like my teeth to be a little bit longer. I think that would allow them to have just better symmetry all around, and if at all possible, for them to be
fuller style, yeah.
forward, so
I agree.
there's a nicer curve to them.
There's a science behind this, yes, you're right, I agree.
And then in terms of the bottom lip, what I find probably more with age, I've noticed that there's asymmetry of the bottom lip, and the bottom teeth are showing more, and because of their symmetry, it pronounced the unevenness is even more pronounced. So just to make it a little bit more balanced in terms of how the lip sits.
Sure.
And
have a look at the slide there. What would you like me to do there?
in terms of this one,
Yes. Same thing.
the coloration, the colour
would be nice. Yes,
I'm not
I
prepared
agree.
to give up all coffee and wine.
No, you enjoy wine. That's not the issue, but we want to get it right.
But it'd be nice to get a little bit more colour, a white and black.
And I think fuller small will improve the upper lip profile as well, and then folding. Okay, well, fantastic. I'm going to show you a couple of different cases so you get an idea that we can decide. Okay, looking forward to the diagnostic comps and mock up at next visit.
Very excited. Thank you.
I'm excited for you as well. My pleasure. Thank you. Well, what do you think?
It feels so long ago. It was actually really interesting listening to that because it's like I got my wish list.
That's right. You got your wish list.
I got my wish list.
That's right.
I forgot the things I mentioned, but now that I'm hearing back, you fixed everything.
Everything.
It's
I'm listening.
especially like the things that I didn't even really appreciate that I remember now. You're saying, the lip profile, the way the chin sits, the profile here. Those things were a little bit difficult for me to quite understand or relate to. I was more focused on the unevenness, the symmetry. So I didn't really appreciate some of the other things, the more finer details, which I so enjoy now. And once you have them, you go, oh my gosh,
Look, I think we've complimented you, my dear. There's no question about that. If you look here, for instance, can you see there's an unevenness of the lip? It drops here.
Yeah.
Okay. And you're a very pretty girl. You just had to do something here to complement your face. And how do you feel about this one here?
So much better.
Can you go a bit closer?
Like I said, it's just
You can describe.
Yeah, it's just like this whole shape. This is lifted. The lips sit nicer, and it just actually even my children said like when I smile, my lips look much more comfortable around my mouth, and they just look more well situated and fuller without anything artificial.
That's right.
Yes, it's evened it out in a way that
that's dropping, and we've lifted up.
Yeah.
And
even the nose,
the nose is lifted up a bit more.
Yeah, it just sort of evens it out a little bit more. It's almost like this is what it was supposed to be.
Absolutely.
So
I just find this is like as if it's been photoshopped and it's a real picture. And it's been
the lifting here. It's like I said. It's those I think when you come in here for the first consultation, you don't take that into consideration. You just focus on the teeth or
that's right.
the tooth that's
it's
always
not the teeth,
you.
Is it? It's all about the face.
It's about the face, and that brings me back to the initial thing you said. No. It's the whole thing.
It's the whole thing. So the teeth create the scaffolding for the face, and look how we've improved the whole outline.
Absolutely.
And if you look over here, and then the difference.
It actually makes you look younger and fresher.
You look
without,
that's right.
you know,
Give that fresh look.
Yes, it's fresher.
Let's look at your profile shots. How do you find that before? Interesting, isn't it?
Yeah, and you can just sort of see it just.
I mean, you pay attention just here. See?
Yeah, absolutely.
I mean, look at the slight drop
the,
there with the jaw formation.
Yeah, and here, like it's this part that you never really notice.
Look before and look at now. What do you think?
Wow, look at that. It's lifted up, right?
Huh? How?
And here, all of that. It's incredible. Like I said, it's incredible.
And I mean, you're pretty there, but here you look. I don't know how to describe. I mean, it's like poetry. You know, look fantastic.
It's a better version of yourself.
That's
like
right.
It's a better. It's almost like more structurally correct. Like it's
is.
just helped your face do what it should do.
It's what the brain sees, and when the brain is happy, what they look, they readjust the whole musculature, the whole pattern, and you know yourself. You've improved your nose, the chin distance. Have you noticed that?
Yeah.
Okay. This is less evident, okay? And this is lifted. You have a turtle. The jaw's brought back, okay?
Yeah.
And the upper lips more forward.
And even like I said, it's this section. It's almost like it's got this.
And there's less wrinkles. I mean, you haven't had any. Did you had any? You never had any treatments.
I don't do injections.
Exactly. I know you don't. And the whole thing. Let's keep moving forward. Now this is your smile.
Yeah.
And this is now.
Wow.
You know, and what was the most important thing from here to there, if you remember? Yeah. What was the most important thing in between?
Me, it's almost like my tongue didn't have enough space to be housed.
That's right.
And whenever in the photos you can see, it's always like sticking out or protruding. It just didn't have enough room to be accommodated. And, you know, and the way the lips, they just look so much more comfortable. It's almost like they've got somewhere to sit and catch on, as opposed to just sort of rising up.
And we did something in between, didn't we? What was that? Remember?
The composite.
The diagnostic.
The diagnostic. Well, for me, that was, again, it's probably an invaluable step. Like I suspect many professionals in your industry don't do this or do it in a different way. I would say never miss that step. Never miss that step. Because I think the difference between...
Look how close it is, isn't it?
Yeah.
When you think about it,
It's incredible how close it was, actually. And I remember you doing it, and it just transforms you. So, and I think it not only allows the client to sort of understand what the picture is going to be like. You're painting a picture for the client, but it also gives you an opportunity to really see how the face revolves around. And I remember you spent so long doing it, and you spent so much focus. It's a creative process.
It's the most creative process.
It's the most creative process, but I would say it's the number one step that I would say anyone considering this, do it, and let someone who's really good at it do it.
Oh, thank you very much. Thank you. Oh, look at those eyes. I mean, that was immediate. Yeah. He came that day, we did this. Look at the eyes, immediate. I mean,
this is incredible.
The eyes are happy. Look, it's just so, last time I know I did the work, but I just can't believe how good it looks.
Looks good. Thank you.
You know, I can't, a little bit more shots of you. This is your profile shots. Look at this.
Look at the taping, right?
Look at this, okay, and look at that. How do you tell the difference?
That is fantastic. Look at that.
So you see.
And look at this, right? Like you said to me, I remember you talking about this.
Yes.
And I heard what you said, but I didn't appreciate what it meant. Like I didn't appreciate how it would look and how it would change the facial structure and the look and just your whole expression. And, I think this does it. So you taking the photos is really an important step. It's an important step.
And when you think about this, the teeth only touch longer from before, but the whole arrangement and the position of the arch, the whole your lip, I mean, look at this, the whole thing. I mean, this has disappeared. Yeah. Okay, it's gone.
And the lips just sit so much more elegantly on your mouth. They look more composed as opposed to stretched or uncomfortable. They're just so much more composed the way they sit.
It does. And your nose is it's just the whole thing is so beautiful. Yeah, it's like a composition, isn't it? It
works. It's almost like I said, this is the way it should have been. Like this is, you've just fixed what if it was done properly by nature, this is what it would have been like.
Oh, thank you so much.
But yeah, it's
We just
this,
complimented.
Look how you've made it sit. It's just that perfect contour, and it sits like. And again, that goes back to the diagnostics. I don't think without diagnostics, I can't imagine as good as the 3D, the digital process is. I know there must be value in it, and I know it must do a good job, but I can't imagine getting from there to here to this now.
Yeah, it looks
without
beautiful.
It being done.
It does. You look really fantastic. It's surprising. Now, coming back to the next few slides, I'll have to share with you. The next few slides, it's quite interesting to see what we're going to notice. And there's a few more pictures, because now I'm coming close to your profile, and then I'm going to go really close now. And can you see the difference in terms of...
Even the nose, right? Like
you're very close, yeah. Just point the nose again.
Look at the nose. It's almost like it's sitting properly. The projection of it seems to be in the correctly positioned.
That's right.
And I mean, the way the lips sit here, and like I said, it's not going down and not creating that bulge down the, age is age, I accept all that. But it just feels like before it was almost like compressing it down, so it was exaggerating this.
Yes.
The neck, as opposed to just giving it structure.
I mean, can you imagine how dentistry changes the way the face looks?
Yeah.
I mean, if let's say you decide to see, let's say, plastic surgeon, they would do all sorts of procedures for you that would be invasive, and stretching the skin or injecting whatever it is required to stretch the muscles, etc., or going on the general aesthetic way without injection.
No injections. No, there's nothing. I haven't had anything done beyond the dentistry component.
That's right. There's no injections.
But this is, to me, I would say anyone who's considering cosmetic surgery, like an invasive process, have a look at this first.
Yeah.
Do the diagnostics, invest in the process, and really reevaluate whether that's the path you still want to pursue.
Sure.
Because to get this, you're right. I mean, look at the chin profile, look at the lip positioning. I mean, it looks like I've had, potential fillers or something.
That's right.
And it's not, it's just...
You had nothing. You just said we just placed the upper arch in the right position.
Yeah, we just they now have somewhere properly to sit, which has given them a better, better form.
Exactly. Now let's go next one. That's a mock-up.
That's incredible, isn't it, when you look at that?
And that's right, that was a mock-up.
That's incredibly
Same patient before, or same position. Okay, on the left side, that's a mock-up. Wow. And here you are.
I forgot how close they were, huh?
So close. And that's the original mock-up.
Yeah, that's incredible.
Interesting, isn't it?
Yeah.
Sometimes when you sort of look at the patient, and you came across very elegantly, so beautifully, and you had to create a concept that fits in. And at your suggestion, we did some adjustments here, and you can see we just refined the mock-up in the final outcome. And how beautiful the whole thing sits. I mean, I know, again, I've done this. We've created this with my technician, Harry, and he followed my guidelines, but the effect is so synergistic. You feel synergy, how it lights up the face. Would you agree?
It really does. Like I said, it's so subtle, but it's so transformational. It's almost hard to describe.
It's very true, very true.
How much it just lifts your face and changes in a very subtle and positive way your own, whatever you have.
Exactly.
It just seems to enhance the positioning of your features, right?
Let's go next slide, of course. Thank you. Let's go next slide. Look at a different view. That is the view we have now. Okay, and let's go next view first. I'm just going to change my magnification. And what do you think of that?
Goodness gracious.
What do you think?
It's fantastic. Look at that. From down like that and pointy to just looks so much
nicer, doesn't it?
So much nicer. It's just softer in a way, and this holds so much different, right? It just has lifted this whole area. And I remember during our first consultation, you will say, it will lift this, and I just couldn't quite understand how changing my teeth or putting, you know, thin little veneers.
That's
would do it.
right.
But it's not. It's so much more than that. And like I said, and that's the difference. You don't just slap veneers on. You really look at what you need to do to enhance.
How do you create the effects using the veneers?
That's right. That's right. Like it's too simplistic to say, oh, Dr. Sarkis will put pretty veneers and Harry does a beautiful job of the color. You do, but it's so much more than that. Like I said, you really change
the whole appearance,
the structure, the bite.
I mean, that image just does it all, doesn't it? When you think about it, am I right?
Absolutely.
I mean, people look at you, they think you had some sort of a facial plastic surgery. We had nothing.
No, that's incredible.
You know, if I show this to the Plastic Surgeon Association, they'll probably hate me.
Back to business. It's like they got all that chin implants.
But all we did refine dentistry.
Right?
That's right. This is aesthetic dentistry, see? It's aesthetic dentistry. Yeah. And we didn't cut your teeth, did we?
No, not one injection and not one Panadol. I didn't have the entire process. I didn't have any pain, like any pain whatsoever. Not during the day, even like the long day when, you know, you applied them all and everything else. He just took the tiniest amount. And when I had the temporaries, no pain whatsoever. I didn't have sensitivity because I was actually, to be honest, I was worried about that for the period of time.
Of course.
While I was waiting for them, thinking, okay, if you've had to shave some, you know, am I going to be really uncomfortable? Nothing. And I swear I didn't even.
You know, this is my favorite picture. This is my favorite picture.
Is your favorite? Oh, that's nice. It's a
beautiful photo. It's. I mean, I'm looking.
Photographer.
Thank you. I need a good objective photograph. That's very important. Let's move on. Now that is the smile. Different angles. We're looking at different angles.
Okay.
Interesting, isn't it?
Yeah, incredible.
Interesting, isn't it? Has to look good in every angle. You see, the aesthetic effect means integration of soft and hard tissues within the facial frame. It has to look good in every angle.
In every angle, yeah.
You know, in every angle. And I couldn't say that you're one side better than the other because you just look perfect in all angles.
Oh, well, that's very generous of you.
You do.
But yeah, the teeth, the way it all sits, it works well. You're right. You didn't just take one photo in the best light and the best angle. Yeah. You took it up, down, sideways. That's right. You know, from every perspective. Angle. Yeah.
Let's go next one. That was the mock-up.
Gosh, it's almost hard to tell what's the mock-up.
That was a mock-up. Can you believe that?
It was very proud.
Huh? Not bad.
That is incredible, actually. Huh? That is incredible.
That's the mock-up there.
Wow.
All right. Now we have to do this to get that.
Yeah.
Interesting.
Incredibly close. This is just a refined version.
Absolutely.
It's almost like, okay, you know, like you do the painting and then you go, okay, they're like
that's
a
right.
bit of touch-ups, and that's what it feels like. Fantastic.
Looks so good. You know, as I said to you, it has to look on every angle. All right, let's move along there.
Fantastic.
I mean, this is we coming to the close ones. That's before. What do you think? Huh? What do you think?
That looks great.
I
love it. I really love it. I wish I did this years ago. I really wish I don't know what I was waiting for to find you. So,
there you are. Well, I'm a good dentist today than I was yesterday. Okay.
You are a fantastic professional, and you've got a wonderful team who handholds the client throughout the entire process. And no question is too many questions. No visit is too many visits. You don't just like, okay, do the job, see you later, we're done. You know, no matter how many times I've called or asked for something, please come in, we'll do it, we'll refine, we'll touch it up if we need to. Mind you, there's basically been no need, but this is fantastic.
It looks so good. I can look at your, I feel like I'm in a museum. And you know, when you go to a picture, and I like to sit down in the museum, see one picture for a long time. Okay. And I just write, and I could sit there for hours and look at your before and afters.
Oh, that's so nice. But it is incredible.
You know, it really is, yeah.
You know, it is incredible. But I just love how it just looks so composed. It looks so comfortable and natural and beautiful without looking. And it still looks so natural.
It looks so natural, and yet you can't falsify. You can't say, worry about this. You just can't do it.
Yeah.
Yeah, I looked at it really hard. I was trying to find a way to say,
Yeah, you're right.
and I thought that's really interesting. I mean, this is, I mean, Harry did a great job.
Harry did a wonderful job. He's a lovely,
You know.
lovely gentleman, and very, very good at what he does. And he's also, like you, very good at. And I think that's why it's so imperative that he did meet me.
I had to meet you. That's right.
Had to meet, because I think you know, again, all the things that you guys said before, I kind of heard and I sort of understood, but now I can really appreciate. You have to know you have to see the person. You have to understand their personality, and you have to see how
It is personality,
the
yes.
shape even fits the person, right?
Exactly.
It's quite an art. It's an art.
It's quite an art, yes.
But this is, like I said, it's brilliant. The length, the shape.
The shape, everything. And I'll try to fault it. I'm trying to, maybe I should do this. Maybe.
No, you won't be able to.
Let's go next one. Different image, right? I've just taken, and this is, before we started, looks so cute there. That's a mock-up.
Mock-up, right?
And that's the same.
That's fantastic.
You know what I mean?
Just fantastic.
You know, and just the
it.
mock-up, yeah,
I
it
love
is.
it.
The
Actually,
mock-ups.
yeah. And look, the mock-up was great,
Mm-hmm.
but again, you guys were really, really good. I couldn't be more grateful, because you took on board everything I said.
And you're going to be so you had to bring this in,
Yeah,
but
it
bring
just
that
was
in,
like,
bring
you
that
know,
in.
it
That's
just
right.
needs to be,
And increase the length of this. Yeah,
Yeah.
we did all that.
you know, it was just like there was something that was, it was so good, but it was just something that wasn't. And that's what I said. You can't get that in a drawing or a picture. You really, until you have it in your mouth like that, I think, and your lips start to move, and the way your personal features and facial movements move around those teeth, you can't really see it. That's why that mock-up process is invaluable.
Thank you. I agree. You know, and this is, you know, this is.
Love it.
Thank you. Now this is before.
Yeah.
If you remember, and this is the smile.
Yeah.
I mean, I know there's not much to go at the end, but I just thought that coming back, looking at this picture,
It's incredible.
you know, and then going back, looking at that picture and looking at that picture, and my favorite. I mean, to me, it's like, you know, I only have pictures like this on the right of like famous actors like Jacqueline Bisset, one of my favorite. You know, like hazel eyes. I mean, your hazel eyes are so evident on the right, whereas on the left side you just don't see them. Have you noticed that?
Yeah, it makes everything.
It captures. It just captures. It's so good. Looks really good. I'm happy. I'm really, really happy.
I'm really happy too. I couldn't be happier. Honestly, I couldn't be happier. Everything, the color, the shape, the bite now.
The bite was comfortable. Yeah. Do you know? I just like to thank you for. You know, it's a journey, and we went through a journey. We came to the destination, and it's a lifelong. You know, you're a friend of the practice. You are a friend. We love you here, and you gave me the opportunity to be able to be creative. And to me, that's just about everything. And I want to thank you for your time and your patience and for your input and your sincerity, all the little things that makes everyone's life so perfect and productive and fruitful. You know, that's what it's all about, really, when you think about it at the end of the day, isn't it?
It's been a wonderful experience. I couldn't recommend it to anyone any higher than this.
Thank you so much. Thank you. I thank you. I'm going to take some pictures.